CASM is today organising an event jointly with our partners at the Financial Health Exchange at Toynbee Hall, looking at the savings versus debt conundrum. We've invited a series of speakers to come along today and to talk about the different aspects of savings and debt and how we might advise people more effectively on the front line. These speakers have included people from the Money Advice Service, looking at some of the latest data in the field, from people representing the fintech industry, and from those of us who are doing research in this area, trying to understand a little bit about these relationships.
We know all about what the official data says about low-income formal savings in a product, and it shows dire results. But what we know less about is low-income informal savings, so literally jam jarring, careful spending. So what this research was about was trying to unpick some of those stories and really get rid of the myth that low-income people have no savings and savings behaviour, even if that's on an informal basis.
So today I came to talk about the results from the Financial Capability Survey from 2015, in particular the drill down that we've done on types of savers, what they do in terms of savings. Do they save frequently or infrequently, a lot or a little? How that relates to whether they use credit or not, and what types of credit they use, and as a consequence, is there any behavioural barriers to becoming better savers or better able to manage in debt and trying to save? And in a nutshell, some of the key messages that we have to give is that people who are either underconfident or overconfident but not quite numerate really plays a big part on whether they are capable to make those decisions. Financial Capability Week is once a year in November. We found last year, we ran it for the first time, supports the financial capability strategy in the UK, and the idea is to bring together the wide range of people who touch on financial capability services, everything from financial education, financial inclusion, activities in the devolved nations, and the idea is a chance to showcase what financial capability is all about, but also a chance to get people together to discuss how we can work collaboratively and inclusively to build a better society for UK.
Oval is a platform that allows people to easily track how they spend, learn how to spend better, save some money, and put it away into investment products. We've designed an app that is very easy to use and that allows a new generation of millennials to feel like they can have control of their finances in their pocket. We believe that banks and financial institutions will always have a big role to play, but today there is a big gap between the products that they offer and how they deliver them to the market. And we believe that fintech can be that layer in between that can better deliver that last mile to users and have that user engagement and interface that banks struggle to have.
We set out to look into how we could encourage and help lower income households save. We felt that there's a gap in this agenda, certainly since about 2010, when the last efforts by government and central policy makers sort of fell into disuse really, or fell out of fashion and was left by the policy agenda. So we wanted to look at not just why people save, but how they save. One of the key highlights that came out of this is we set out thinking about contingency funds, or so-called rainy day funds, and actually it transpired from talking to a lot of people that we needed to be much more positive in our language. We needed to set positive goals, sometimes fun goals, sometimes sort of lifetime goals, like saving for a wedding, saving for a car, or just going on a holiday. And we just felt we'd got our language quite wrong.
So this has given you just a little bit of a snap view of the interesting event that we've had throughout today. Do please feel free to have a look at some of the presentations that you'll find also on this page. And please look to come to one of our CASM events in the future.